them in the majority of the time, they're not aware of the fact that our healthcare systems work so different. So in many countries, the population that we are serving comes from places where they don't have a lot of preventative care. In many rural areas, they don't even have medical care, so they have to travel far. That's why there is such a high belief in our communities with home remedies, and you hear things that maybe our medical community here, and it can be from, I don't know, a child having fever and they show up and the kids got pieces of onion inside their socks because there's a belief that this will bring down the fever. We could sit here and argue if it works or it doesn't, but it's just being aware of all those things. Many people may not understand that, for example, hearing loss is not a disease, but it's something different. Understanding genetic conditions that can lead into hearing loss, and that this could get worse. Some people just think hearing loss is just for those who are getting older, and in many of those cases, they still don't always seek preventative health care because of many reasons. So those are some of the issues that I'm going to talk about in a little bit, but that's why I reiterate the importance of using professional medical interpreters that actually can help you bridge that gap in communication as well as in cultural differences. Another piece that I like to remind people is of using translations when you're providing written materials to your patients. I often see and I often help providers who are very thoughtful about the idea of providing interpreters, which I love and I'm so grateful for. And again, additionally to that, it's important to provide translations. So I myself, I am primarily an interpreter. I do translations, but I am not a translator on a daily basis. My thing is more speaking, working directly with the community. I like to think of the difference as an interpreter may be a great orator or somebody who can give speech and perhaps not very good at writing a book, which is more of what a translator will do, meaning they're more in tune with written communication. Not that we cannot do both. I myself do both, but in general, there are some differences. So you're in the clinic, in life, you're not working with a translator, you're working with an interpreter. Translation materials is what you should be thinking about providing when you are providing written information to your patients. So far, I want to give a brief pause. Are there any questions, thoughts so far before I continue to the next slide?
I have one.
Please go right ahead.
This is Emily. So would you recommend that if they're maybe not, maybe they're proficient at English, but it's not perfect, would you still recommend a translator, even if they've got, let's say, like broken English, or it's functional enough for the appointment, but maybe we still need it?
Emily, thank you. I feel like I ask you to ask that question because it's a perfect question that I'd love to address. This is a very common thing, and this gets complex. And again, I've been on the medical field for a long time, and I can feel the difficulties not only from the patient's perspective, but from you as providers. And I will say, in an ideal world, I would say, yes, use a professional medical interpreter if you are not comfortably fluent in the language that you are being tested on. So I say this because of a couple of things. I remember when I first moved here, I didn't speak English. I moved to freshman year in high school. And let's say a year later, I was already starting to become not fluent, but I could communicate. About a year and a half or so, 2 years, I started to be able to comfortably communicate, but nowhere near to where I am today. I could have never watched a comedy show. It's one of those tests that I always give people who say they are fluent. I say, well, let's watch a comedy show. If you can get the culture on the comedy, you're at another level of language understanding. And why I mention this is because if somebody who is somewhat bilingual, and this will be, of course, very difficult for you to determine, so you depend on the fact that this person is willing to share and be open about it. They need to be able to tell you where they're at. But if you were to do testing on Mauricio when I was a year and a half into learning English in a quiet setting in English, I could probably test out very similar to Spanish. But if you were to do that in a noisy level, my testing, for example, let's say I would have been a candidate for cochlear implants, I very likely wouldn't have met the requirements of cochlear implant, hypothetically speaking, of course. If you were to test me in English, be in a noisy environment versus a quiet environment. And I probably would have been tested higher on my hearing if you would have to do that test in Spanish. So does that answer your question, Emily? Do you see where I'm going with this? That's just an example.
Sometimes, you can get through maybe the counseling, but when you get down to the detailed, are they hearing the phonemes? They probably are and can't pronounce them, or, you're not sure sometimes about the data. So even if they're not 100% proficient, it sounds like if we know in advance, we should call someone in to help with it.
I would say so, especially if you're in an, thank you again for that question, Emily. I would say that in general, if you, especially if you have the ability, if you work in a healthcare institution that does have professional medical interpreters, like myself and my colleagues here at mHealth Fairview, I would suggest that you do, just to make sure. It's always easier to send somebody home or to tell them to thank you for the interpreter and the services are not needed, than to try to scramble last minute and try to find an interpreter. Sometimes I have done that in the past where I'm showing up to an appointment and the patients are like, I want my autonomy. I know I can speak enough English to get by. And then I show up and I just say, would you mind also I said also because I thought as I was speaking that you as providers have the right to ask for interpreters, and you can explain to your patient, this by no means is that I'm undermining your language skills or anything. I just want to make sure that I provide you with the best possible medical care. And I just feel like it would be better to have one of my medical interpreters here with me. And that's why it's important to work as a team, because if you and I can brief each other prior to coming into this appointment, I can be very transparent and say, hey, I respect your language skills, and I just want to make sure that you know that I'm here to help you for any questions or thoughts that arise during the conversation. And sometimes I just sit back, and then there are many instances where I've sat back and all of a sudden I come in and people relax and start to speak Spanish and they allow me to do the interpretation. Also, don't use family members. You're always using a filter. Medical terminology is much more complex than people think, especially conveying communication that you may think it's simple, because we get on the medical field, and I've been on the medical field for a long time. What we think is simple is not simple to a lot of people, even English speakers who are not in the medical field. So there is go ahead, please, Emily, go ahead.
I agree with you there. I've seen families argue back and forth and then turn back to me and say, yes. And that the patient said about 20 things that the person did not express to you.
Exactly, Emily. And I think this is crucial for you as providers to know, because you're always balancing. It's one of those points that I was going to mention. We live here in the United States, a very autonomous society where I can go, it's okay. I mean, no one's going to be like questioning why I show up to the doctor with no one accompanying me to the appointment and me making decisions for myself. But in our communities, we're very community oriented. So it's very often that you will see family members coming into the appointments. You want to know what those conversations that are being said back and forth between the family members, because you may have a family member who's saying, she cannot hear anything. When I turn on the TV, she can never hear me. And then you got other family members saying she can totally hear fine. She doesn't need this and she doesn't want to use it. And then you're going to have to at some point allow the patient to speak, who's most likely the one that needs an interpreter. But you should provide also interpreters for family members if that is the case. But you want to be, as an interpreter, my goal is to be invisible and to provide you with as much information. And I say as much is because sometimes I myself cannot hear it. So if I can't hear it, I can't interpret it. But if I can hear it, I want to make sure that I tell you everything. Also have the resources available ahead of time. If you see that you have a patient who speaks Spanish, a lot of the companies that either cochlear implants or hearing aids have these documents in Spanish. And if they don't, they're not already on their website. I am certain that if you just I know for a fact because we've done it in the past. You shoot them an email and they send you those packages and information, even when they send you the hearing aids in Spanish, so that you know they're going home with this information in a written format. So these are some of the language barriers that people have, and why patients don't always follow your advice. Here is what I talk about: patient autonomy and family involvement. I think family involvement is crucial, and you want to always have them involved as much as possible, because they're more likely to follow up on your recommendations as medical professionals. If you allow the family member to be a part of. If you have adult patients, it's, especially in our community, it's very common that as our elders get to a certain age, the kids start to take over. But so you're balancing this very fine line between providing autonomy and voice to a patient, and also allowing these family members to help this patient make decisions. But I think it's crucial to provide an interpreter for an adult patient. Let's say, not long ago, I was in an appointments for hearing aids for a patient who is 75. So while her daughter was making all the decisions for her, she ended up having a lot of questions when I was there. And she ended up even having some back and forth with the daughter they were not necessarily in agreement. Her daughter was like, well, I didn't know that you couldn't hear in those situations. I had no idea. Why didn't you say something, Mom? So a lot of times family members actually learn about the realities of what their patient is going through once they're in the appointment with an interpreter. Let's move on to the next. Some of the areas of growth that I think we could definitely do better in all of our clinics is to provide translated documents. And I cannot emphasize this enough. This is really important. You cannot think that you're doing any service to the patient if you send them with documents in English if they don't speak the language. I also recommend to you that you reach out to people like myself and others in the community. Well, a lot of organizations, healthcare organizations, have connections to some of the communities. Social workers may be able to help you with this. On what are some of those areas, like here at Minnesota, we have Clues. And I say these resources because they can come in handy. Think about, are they speech language pathologists in the area that are bilingual? Could this be more helpful for a child who's being raised in a bilingual environment, and you're recommending some of this rehab? Or for example, somebody who just got new cochlear implants and you're asking him to do the rehab. And I know some of the examples, and I'm not the medical expert, you guys are, but I know that with my experience, you sometimes have them review audio. So there are plenty of books like in Audible in Spanish, videos on YouTube that are in Spanish that could help this person. And perhaps they want to, even if they're bilingual, if they feel more comfortable in Spanish, maybe they want to hear those things in Spanish first as they're trained their ears to use the cochlear implant and their brain, and to use these devices now in English. Also, I think it's very important to think about the fact that a lot of the medical research that is being done is not done equitably with Hispanic community in mind. So think of that as you guys, I know you guys I'm sure I have amazing people here who are doing beautiful, wonderful research, and maybe at some point write a book or something. Keep that in mind as you're engaging in research. How can I involve the community that I serve better? How can I make this a more realistic and reflective way of what the communities that I serve are actually facing? And this Hispanic community is growing. I think in no time, we will be the second largest group in the United States. So I think it's important to keep that in mind, that the amount of patients that you see who identify as Hispanic or Latinx will only continue to increase. I know that currently the last information that I read is that there were only 2.7% ASHA certified audiologists who can provide services in Spanish. So I think this hopefully will continue to increase as more and more of the Hispanic population continue to move up in some of the medical fields. But I recommend that you think about this as you're doing medical research, as you are making these recommendations, as you think of this testing. Has it been inclusive enough to the communities that I serve? So I know I don't have a whole lot more time, but I want to make sure I give opportunity to a couple more questions, because I believe that this will allow us for a better conversation. Go ahead.
Wonderful, Mauricio. That was great. So I have a question for
Please.
you. So When we are working with an interpreter, whether they're professional medical interpreter or not, if they, when you say something that's like 2 sentences long, and then they say, they interpret it to the family and it's like much shorter, or the family is using many sentences to talk to us, but then the interpreter comes back with a very short little snippet. How do you know if they're fully interpreting what the patient's saying or what the audiologist is saying?
Thank you, Maureen. That's a great question. And I always recommend, and I know this is recommended in the medical field, regardless of language, for, repeat back, what are we going to be doing? What is the plan of care that we just decided for you, that you accepted? Can you repeat back? I just want to make sure that everything was clear and that I explained myself properly. That is one way to do it. And I do want to mention that this varies from language to language. There are many languages, and I don't want to deviate because we're focusing on Hispanic and Latinx culture and Spanish-speaking patients. But sometimes the words are not there in many of this other language, and so they have to elaborate much more. So it sounds longer usually. Now, the fact that it is going longer back and forth between the patient and the family, I would just politely ask, please, this is all of the information that is being conveyed is very important for me to hear, because I want to understand where the family and the patients are at. I'm going to ask you to please just interpret everything that is being said and ask for pauses or repetition if you think we're going too fast for both the patient and I. I just want to make sure that I completely understand what my patients, where they're coming from. And I know you can even say, I know that language is complex and sometimes they're discussing about what the terms are, but transparency, and good interpreters should always provide transparency. You should not have to do this often. And if it's something that continues to happen, maybe address it with the interpreter after, or if they continue to do it and you see them often, just address them directly with their supervisors or the agencies that you're working with, because it is crucial to provide complete transparency. I want to make sure that you understand everything that is being said in the room. That is how I feel that if you're paying attention, that you will be able to really understand where they're at, and trying to bridge that gap of difference in culture and language. Does that answer your question, Maureen?
Yeah, no, it definitely does. Thank you. What is your thought on phone interpreters?
That's another great question. I think there's a place and time for it. And the reality is that we are now, the field of medical interpreters is becoming very small, a very small pool of interpreters in each state that you can actually, for physical in-person interpreters to be able to access. And I know this is probably the same case in many other states and perhaps even countries. So I know that the reality is that remote interpreting is here, it's here to stay. And I think there's a place. Audiology is not the best place for me to be utilizing phone interpreters because of the fact that how are you going to, it gets very complicated when you're going to put them in the booth and you're going to be doing some hearing testing. And then if you get to the part where somebody has to read some of these questions or the wording, the words that you want the interpreter to read in Spanish, because you only have them in English, unless you already have a pre-recorded setup in different language, you're going to need the interpreter physically there. It's going to be very difficult to do over the phone. So I think it depends. I mean, maybe for somebody picking up their hearing aids and they're just doing, they just got new molds and you're doing some fitting and perhaps you're changing batteries and it's already kind of just a continuation of care. You already have the setup, the program is already there. You don't need to ask a lot of things because there isn't new hearing loss or anything else. I think it's appropriate if you're in a room where you have the appropriate equipment to do so. But in many of these cases, I think if they're going to see the ENT, also remember if they're going to be cleaning out the ears of the child prior to seeing you in ENT or after seeing you because there's so much wax and impacted that you can't even do the test. The screaming and all of that makes it very difficult for the interpreter to be able to communicate and bridge that communication gap. Anything else? Does that answer your question, Marie?
Yeah, it definitely does. We were just saying you've clearly been in our peds department quite a bit. So another, I guess, pediatric question.
Please.
So when you're working with a child who is fluent in English and also Spanish, so they're bilingual, but their parent or caregiver or whoever's with them, aunt, uncle, they need the interpreter. And so we have the interpreter for the parent. Is it your duty to interpret every single thing that's being said?
Completely. And one of the things, that's a great question again, Marie. One of the first things that I do is I introduce myself to the patient and the family. And I say, just so you know, it's important for you to remember that I'm here to help you. I'm not here to hinder you in any way, shape, or form. So I would like to ask, and I know this ahead of time, I usually would ask the child or the adolescent or teen, I'm guessing you're fluent in English because of the way you responded to the first greetings already when you're establishing rapport with your provider. And oftentimes I'll say yes. And I just want to ask you a favor. In order to allow me to help your mom be in tune of everything that is being said, I'm just going to ask you to pause before you answer a question in English. I'm going to interpret the question, and then I'm going to ask you to pause after you respond, because I want to interpret your answer just to make sure that mom is in tune with, or dad, with everything that is being said. And I will ask you as a provider to allow me to do my work to make sure that everybody knows what is going on in these conversations, because oftentimes this is what gets difficult. It goes back and forth, and you don't have time to do it. So I, as the interpreter, need to make sure that I am the one dictating the tempo, because I'm the only one that can handle both language and make sure that they're conveying the appropriate target language that we are addressing. So does that answer your question, Marie?
Yes, it does. Thank you very much.
Yes, of course.
All right.
Are there any other questions?
If none more come up, I have one more
Hey, please.
question about, we were talking earlier about preventative healthcare in the Hispanic community. Can you share a little bit more about that?
Yeah, thank you. You know, a lot of our patients come from communities that do not have access to preventative medical health care. Aside from also the fact that even when they move here, they don't always understand the medical system. And so they're more likely to go get care once the problem is already there. And I know in audiology, a lot of what you're trying to do is prevent and try to get them to a point where you get them hearing aids early enough so that they can help, it will help them develop their speech and so on, and try to see where they're at with their hearing loss and help them understand where they're at and why they have some hearing loss if they do. And I think in our communities, there needs to be a lot of education, and also for the providers and the entities, if we don't have access to providing care to patients who do not have healthcare, insurance healthcare, then it's very difficult for them to sometimes access some of the preventative healthcare. So, and I know it varies from audiology to medical to dental and so on, but in general, that is one of the barriers of why people do not always seek medical attention ahead of time. They don't always know that these things even exist. A lot of patients don't even know what hearing aids are. There may be a taboo about them, and I know this is even in the English-speaking community, but it does get farther, and it's exacerbated in our communities because of the language barriers, because there is fewer information available. And a lot of times what I say in for the medical field is I say people like myself who like to work with the community a lot and help them understand how the healthcare system functions, is a lot of education and a lot of fighting misinformation. This can be misinformation from either ideas that there are within the community or misinformation on the internet. And so there is a lot of work that we can do as providers to make sure that we provide some good information, factual information about what it is, in your case, audiology, testing, why it's done, explain a little more about what genetics is, the basics of genetics, if these are the reasons why there is a genetic component to the hearing loss and how it can be intertwined with many other medical conditions. Does that address the point you wanted me to address?
Yes, it does.
That, Marie?
That was perfect. Okay. Thank you.
Yeah, of course. Are there any other thoughts, comments?
Yeah, we have 7 minutes left. So if anyone.
Oh, we have 7 minutes left. Sorry,
yeah.
I was speeding
well,
up.
Oh, no problem. Just if anyone has any questions, we have this fabulous resource here. So feel free to fire away.
So as people think of questions, one of the things that I've noticed in many of our rooms, for example, is that we don't always have the space to set up the interpreter, the patient. So I always recommend try to set the interpreter closer to you versus the patient so that you can have direct contact, visual contact with your patients. That is another one of the reasons why I like to do my work in person if possible, is because there's a lot of nonverbal communication, especially in places like this, where there may be some hearing loss or there may be some issues with speech. So always have the interpreter facing the patient as well as you facing the patient. So next to you, it's almost like a triangle, but closer to you, if that makes sense. The patient is in front of both parties. And also try to keep in mind that a lot of our patients, even those who always use interpreters, may understand quite a bit of English, but they don't feel comfortable communicating any of this medical terminology or being in a medical care setting. So build rapport with your patients directly. Always refer to the patient directly. Don't ask the interpreter. Please ask her if she has done this, this, and that. Just directly look at them and address them directly. This will provide a better rapport with you and the patient. I, as an interpreter, again, I want to be almost invisible in the room. You and I can brief each other prior, which always makes you as a provider, as an entity, look better, because if you have a complex case that you already know ahead of time and you brief me before we begin, this can be very helpful for me. Also, if you're going to be addressing, remember that medical terminology is very there is so much to it. So if you're going to be talking about one particular new cochlear device or new hearing aids and all the specifics in the technology that this patient's had issues with in the past, or perhaps you're moving him to a cochlear implant because the hearing aids have not worked in the past, and you want to begin this conversation, provide that feedback to the interpreter. I am your resource. I am your aid to try to help you get to where you want to get this patient's care. So if you give me this information, I am much better prepared prior to going into the session. You look better prepared, and so on. And defining the resources, often your interpreters can help you with this. And ideally do this prior or post the clinic appointment so that you don't have to have these conversations in front of the patient. I think it makes us look more professional and more in tune with what we're doing. And just think of the differences in the community. If you can allow the daughter and the son and perhaps a cousin, I know sometimes it's too many people, but sometimes these are the people that are going to be making the decision with the family. And if you have them there, you're going to save yourself some time, and probably I will say in likelihood, they will be more prone to follow your medical instructions and directions, because a lot of times I notice that patients, once they hear something they want to hear, that's all they hear, and they don't hear the rest, which can be very important about what it is in the future that you want to do and help them do. So that is one of the thoughts that I have for why I think it's important to try to provide medical interpreters in person. And if you work with your institutions, it's important to remind them of why it's important, because a lot of it is lost in translation when you are working through the phone and video. Even if there is video, the visual field is not amplified enough for me to have contact with you as a provider. I don't know if you're getting frustrated because you've gone over this 3 times. I don't know if you're running out of time. I can read a lot of these things with nonverbal language that I cannot read when I'm on the phone. I also cannot read how impatient the patient is or the family member is based on how they're moving their leg. I mean, there's so many things that I'm looking at that I can help you have a better communication with this community that you're serving.
Absolutely. All right. This was wonderful. Well, I'm happy you provided your email there. So people, if you have any further questions or thoughts, please contact me or contact Mauricio. I'm sure he'd love to answer some more questions.
Yes, please. I would love to help you, help my community, and help you provide the best possible family patient-centered care than you can, because I know that we care. That's why you're in the medical field. I just think it's a matter of understanding the communities that you're serving better and providing even better care. Also trying to leave some of our biases and assumptions that we often all of us bring to the table. So thank you so much for your time. I appreciate you, and thank you for inviting me.
Great. Thanks so much. This will be recorded and sent out to everyone who registered. Thank you.
Thank
Bye.
you. Bye-bye.